Minnesota has consistently been one of the healthiest states in the country. So when I give speeches about public health in Minnesota, I paraphrase a Garrison Keillor quotation. Minnesota, where the women are strong and the men are good looking and all of our health statistics are above average. That usually gets a chuckle until I follow with the next line, unless you're a person of color or an American Indian. Averages hide the fact that Minnesota has some of the greatest health disparities in the country. That's why the Minnesota Department of Health has made advancing health equity the main focus of its activities, and why it is the central challenge for our state and for the country, because those disparities are not unique to Minnesota. If we are to be a healthy and prosperous state and country, everyone has to have the opportunity to thrive. That's why we'll be talking about health equity on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. In 2014, the Minnesota Department of Health submitted a report to the legislature entitled Advancing Health Equity. This report highlighted the necessity of addressing health disparities and increasing the opportunities to achieve good health for everyone living in Minnesota if we are to be a healthy state. Today we're going to discuss some of the activities that have emanated from that report. In particular, we'll be looking at some of the work being done by the Center for Health Equity, which was created within the Minnesota Department of Health to lead, encourage, and support efforts to advance health equity. Joining me in that discussion is Bruce Thao, Director of the Center for Health Equity at the Minnesota Department of Health. Bruce has a strong record of working to advance equity with previous leadership roles overseeing local, state, and national work at Minnesota Philanthropy Partners and with the Hmong American Partnership. He's been recognized as a White House Champion of Change and has been a Bush Fellow and an Aspen Institute Scholar. Bruce, welcome to our program.
Thank you.
And thank you for taking on the leadership role of the Center for Health Equity. What sort of brought you into the whole field of being interested in equity and some of the work that you've done prior to becoming at the Health Department? And why did you take this job at the Center for Health Equity? What is it in your background that said this is an important work to do?
Yeah. First of all, thank you so much for having me on the show. Excited to be here today. My background is in mental health, in psychology and social work. And so I've been trained both as a clinician and as a caseworker, as a community organizer. And so in my family, I was the first one born in the United States. My family came as Hmong refugees in the 1970s. And so I kind of grew up watching these two different worlds of me going to school and seeing these American education systems, and then seeing my family really struggle with how to navigate systems like the workforce or healthcare, how to get a job, and just the stark differences between what I was seeing in my community and what I was seeing in the broader American community. And so that always gave me a lens to think about equity or inequality, and what are the ways that I can show up and help make a difference so that there is an equal playing field for all people.
Right. And you raised a couple of terms: equity, inequality, and also people think about disparities. And I talked about we have some of the disparities. When you think of these terms, how do you distinguish disparities and inequities? Is there a difference?
There is, and not a lot of people who are not in the field are aware of the differences. And the ways that I think about it is, a disparity is naming that there is a difference in, when we're talking about health, there's a difference in health outcomes between two different groups of people based on some sort of demographics, whether that be socioeconomic status or race, things like that. But then the inequality is when you dig a little deeper into why that disparity exists, and you may find that there were policies or systems in place over time that created or contributed to why there was such a difference between groups. And so the inequality is looking at a disparity, but more at a systemic level and ways that it has been perpetuated.
Right. So we're not going to talk about specific disparities in this. We're going to talk sort of generally about why disparities exist and some of the inequities that led to them. And I have a slide here that really shows the change in the percentage of populations of color and American Indians in Minnesota, and and it really shows that over the last 50, 60 years, we've changed dramatically in Minnesota. Is this one of the reasons why we need to pay attention to disparities, since race, ethnicity is often one of those things that is behind some of the disparities?
Yes, it's definitely a huge issue that I think not only the state of Minnesota, but the country is grappling with. And if you look at the national statistics, they're projecting that by 2050, the U.S. will be over half people of color, American Indian. And so if you're thinking about today and that there are significant disparities and inequities across these groups, then by 2050, if those continue, then we're really going to be much worse off than we are now. So we need to be thinking about those issues today.
So in one respect, it's a math problem, right? If we don't reduce the disparities, our average is going to come down.
Right.
But I suspect it's more than that.
Right.
What is other than being a math problem, is it seems to me like it's a social justice problem, that we want a society where everybody has the opportunity to thrive. Is that true?
Yeah, and that's really how I think about what health equity is, where all people, no matter where you come from, or your background, or where you live, are able to live healthy lives and thrive, like you said. And I think it is really tied to social justice, but it's also tied to workforce development. It's tied to our economy. If we don't have healthy people, then we're not going to have a workforce. We're not going to have a thriving economy as well.
So actually addressing inequities is really a societal issue. It's not just a health issue.
Right.
So have there been identifications of places where you have more inequities that people, societies just don't do as well as places where there are fewer disparities?
Yeah, a lot of research has looked at place-based disparities. So often there are looking at either centralized urban areas where there may be pockets of disparities that rise up even in a larger urban area, and then often in rural communities which may not have as much access to some of the social services or technologies or resources that larger urban areas have. There's disparities in rural communities as well.
So in the Center for Health Equity, we showed the slide that showed basically the increasing number of people of color and American Indians. But what other kinds of demographics are you concerned about in terms of inequities in Minnesota?
There are a few different groups that we're focusing on, which is based on the research that the Minnesota Department of Health has collected and analyzed over time, which shows that some of the communities most impacted by health inequities include race and ethnic minority groups, as we discussed, those with place-based disparities, which I just mentioned, the LGBTQ community, which is lesbian, gay, bisexual, trans, or queer communities, and also Minnesotans with disabilities. Those are some of the most prominent health inequities that we have really rallied around to uplift those communities and really partner strategically and intentionally with them so that we can work together to eliminate health disparities.
Right. And I assume there are disparities also based on income, knowing that income is a great predictor of health.
Yes.
That the low-income populations are probably have lower opportunities to be healthy.
Yes, and income and socioeconomic status is also a lens that we use to think about across all the communities, what are the ways that we can support.
All right. Well, I want to talk a little bit about some of those determinants of health, but first we need to take a little break.
Great.
We'll be back right after this message.
Tonight, along the Texas Gulf Coast, utter devastation. Harvey barreled ashore overnight, packing 130-mile-an-hour winds, blinding sheets of rain, and a treacherous storm surge.
Harvey can't mess with Texas. So donate now to help make Texas whole again.
Welcome back. We're talking about advancing health equity with Bruce Thao from the Center for Health Equity at the Minnesota Department of Health. Bruce, I'm going to put on a slide here that identifies what we call the determinants of health. I know most people think, well, it's just people, if they don't have health, they don't have good medical care, or they're making bad choices about physical activity or nutrition. And this slide points out that things aren't exactly that way. It's not necessarily about individuals. It's really about other things in the system. Explain what we're seeing in this slide, this pie chart.
Well, one of the ways that we often talk about the determinants of health at the Department of Health and at the Center for Health Equity is that health is really created by where you live, where you work, and where you play. And all of those things are also tied to broader factors like, do you have access to transportation to get to your workplace or to get to the grocery store? Are there grocery stores near you where you have access to healthy foods? And so all of these things that we don't really think about when we think about health are really the little pieces of our everyday lives that really do contribute to how healthy we are in our homes and in our communities and in our families.
So healthcare on this slide shows it's really only about 10%, really an important piece, I suspect, but all of the focus on getting people access to insurance and healthcare, that's not going to resolve the disparities? Is that true?
Not by itself. And so they of course are a critical component to our health and livelihood. But as you see on the chart, 40% is social and economic factors, like the issues that I mentioned. And then you have the physical environment, the genes and biology, clinical care, only contributing for 30% combined.
So when we have, do initiatives to address those, we can't depend just on the healthcare sector to resolve this problem. Is this really a community problem that we have to deal with?
It is. It's a community problem, it's a societal problem, and it requires taking a step back and looking at the big picture of what creates health and how we all play a role, whether we consider ourselves in public health or in healthcare or not. We all play a role to contributing to health.
Right. So how do you do that from the Center for Health Equity? So let's get at, what is the role of the Center for Health Equity, both within the health department and then in the broader community to change that conversation about what creates health. So let's, what do you see as the purpose of the Center for Health Equity?
Well, as you mentioned, the 2014 Advancing Health Equity Report really was a catalyst in putting the conversation of health equity on the table, both for the state and nationally. And I remember when I was still working at a nonprofit doing health promotion, health education, and the report came out and I read it and it talked about structural racism, I was blown away to see a government agency name that. And so in the same way that the report prioritized these different areas to say we need to address it, that's what the Center for Health Equity does as well. And so with the really clear focus on the communities that we discussed that have the highest health inequities, we prioritize our engagement and partnership with those communities intentionally. And it is both an internal and external role. And internally, it's about helping to align and support all of the different health equity efforts already happening across the agency, because there's a number of different efforts that have been happening for a number of years. And then externally, I see our role as being a hub and a connector for the community to access the Department of Health, to access resources or partnerships within the department, and then also to be a hub and a convener for other groups that they may not be aware of, other advocacy groups, legislators, and being able to connect all the dots.
So, within the health department, as I'm well aware, as the commissioner, we have a whole range of things going from long-term care and environmental health and infectious disease and food. And how do you support all of the equities without saying, equity is our job in the Center for Health Equity, that it's really everybody's job within the department? How do you help get that message out?
Yeah. Well, I think part of it is that I've seen, so I'm 3 months in, so they're calling me a veteran now. But what I've really seen is how your leadership and your leadership team have really set that tone of having all staff understand that this is all of our jobs. So it's not just on the center, it's not just on me, but really how can we be a support for all the different initiatives happening. And what's been really exciting for me in my short time there is learning from all of the different leaders across the divisions and the bureaus about the diversity of their work and how they're approaching equity within their different areas and focuses.
And have you seen any influence that that has had with other agencies of state government, not just within MDH, but in you mentioned transportation and housing and economic development. Have you seen some of that spill over into a broader conversation within the administration?
I definitely have, and I think it looks a lot of different ways, and sometimes it's really informal, and as I get to know my colleagues at the other state agencies, I've seen that they're really looking to the Department of Health as a leader in this work and wanting to learn more about our strategies, how to adapt our strategies to their work. The state agencies are so different, but there are some core pieces that they can adapt that would work really well in their agencies. And so that learning and sharing process has been really valuable.
Good. And I want to talk next about some of the influence the agency has had and your unit in particular sort of throughout the state. But first we need to take another break.
Great.
We'll be back right after this message.
Yes, but see, you don't have a college degree.
Well, no, but
Okay, well,
Wait. Before you skip over me, can you at least hear me out? No, I do not have a college degree, but I've been working 2 jobs since the age of 18. I've been doing internships while raising my little brother, and any moment that I can spare, I'm studying, just trying to better myself. Okay, I'm ready for this.
wow. I'd love to hear more.
Look beyond the resume and discover new ways to develop great talent at gradsoflife.org.
Welcome back. We're talking about health equity, particularly the activities of the Center for Health Equity with Bruce Thao, who is the executive director of the Center for Health Equity. Bruce, as you'd mentioned, and I did in my opening remarks, the department has made advancing health equity the centerpiece of everything that we do. And we put together that's something that we've called the triple aim of health equity, which we'll show on this slide. And I'd like to have you kind of walk us through that triple aim of health equity and how you're using that to really educate the broader community, how you're getting to challenge the broader community, how you're getting new partnerships in as we work through advancing health equity.
Sure. So at a really high level, the triple aim of health has these 3 core components that are necessary in order to achieve health equity. And so the first piece at the top is about implementing health in all policies, and that's tied to what we talked about around the state agencies and how we partner together to really show that health is created not just by the Department of Health, but by all partners across the enterprise in the state. The second piece around strengthening community capacity really is a critical role for the center as we see ourselves as a connector and a hub. And so being able to support communities either in accessing MDH or accessing and communicating or partnering with other folks in the community, we play that role. We also have our Eliminating Health Disparities grants that help contribute to building community capacity. And then this third piece is about expanding the understanding of health and what creates health, which is tied to what we talked about earlier around social determinants of health and helping the broader community understand that health is not just created by healthcare, like we talked about. And at the core of this triangle is this little bubble that says social cohesion. And what that's talking about is that when we have all of these 3 areas that are really supported and working together, it creates a community that is cohesive, that is together, where people feel like they belong, and that ultimately also contributes to a healthier community.
Yeah. It seems like that social cohesion piece is sort of countercultural right now, when everything, it seems to be, at least nationally, is pulling us apart and putting walls in places. And is social cohesion one of the core components of really advancing health equity?
It is, and especially in political times like this where there is a lot of divisiveness, it really requires us to look beyond labels or ways that we may be othering people and thinking more broadly about what are the ways that we are so similar and how can I support you as my neighbor rather than as this label or category. And so we're trying to create that through the triple aim in order to achieve health equity.
And you say you've been in the department only about 3 months. You know, prior to that, you know, you were outside in the broader community working. Did you see some influence from this triple aim of health equity and the work that the center was doing and the department was doing? And how did you see that manifesting itself in Minnesota?
As I mentioned, I think that the Advancing Health Equity Report and the creation of the center really has been a catalyst just to have the conversation. Because I think that before the report and before the center was created, I think people were afraid to name the different issues or barriers to health. And so it has created this opportunity to have the conversation. It's given the state common terminology and language to hold a conversation and know what we're talking about and be on the same page. And so I think even that has been a huge step, and it sets the foundation for us to go further from here.
And I know oftentimes in the past, specific communities sort of felt isolated or not, or disempowered. Are you seeing a change? Are you seeing communities really come together or being more actively engaged in advancing health equity than they've done before?
I think there's a number of different ways that I have seen that, where communities are realizing it's almost as a result of the extreme divisiveness nationally that groups are seeing that we can no longer afford to argue or compete against each other, and that it requires this unification to really move issues that they care about or that are impacting their communities. And so I have seen that happen.
All right. What about the business community? You know, we talked a little bit about how economics is really important for health. The socioeconomic determinants are there. Does the business community recognize that equity is really in their best interest to advance at this stage of the game?
I think that we often hear a narrative in the media that business owners, especially small business owners, are against some of the healthcare issues, especially that have been happening. But I think at the end of the day, there are so many more business owners who really care and value their employees and their employees' families, and they want their staff and their teams and their communities to thrive and be healthy.
So why should people at the top of the socioeconomic and health totem pole, more or less, be concerned about health equity?
Well, I mean, there's the moral imperative of having all members of our communities be healthy, but then I think there's, as I mentioned earlier, the economic incentive to realize that the reason that you may be wealthy is because you've benefited from economic situations, and so if health does not improve from where it is now, you will not have a workforce.
So as you're looking at your time as the director for the Center for Health Equity, what do you see as some of the next things that you really need to push to really advance health equity in Minnesota?
Well, I think it's a continuation of some of the things that I've been doing in my first 90 days, which is really about strengthening and building authentic community partnerships externally, working closely with academic institutions, with hospitals, with healthcare institutions, a broad set of partners to have this conversation and be on the same page. And then also working internally, supporting our team and our staff who are doing phenomenal work around health equity, but helping to amplify that message externally and also helping to support that work internally.
What kind of a team do you have in the center?
We're a small but mighty team, so we have about 8 staff. that work on a number of different issues, from grant management to infant mortality to community engagement to helping with internal processes and systems around equity at the department.
Right. Well, Bruce, thanks for being on the program, and thanks for taking on this awesome challenge, because it is, I think, the central challenge that we have in this state. So good luck.
Thank you. Thank you for having me.
Good. I'll be back with a closing comment right after this message. Dr. William Fagey, former director of the Centers for Disease Control and Prevention, said, "The philosophy of public health is social justice." Dr. Martin Luther King Jr. stated, "Of all the forms of inequality, injustice in health is the most shocking and the most inhumane." When you pair these two statements, it is obvious that eliminating health disparities, an issue of social justice, should be the primary objective of our public health system. For reasons largely outside of their control, too many people are needlessly dying young or living with unnecessary infirmities. A disproportionate number of these individuals are people of color and American Indians. This highlights the fact that there still exist in our society policies, systems, programs, and institutions that systematically disadvantage some population groups over others. In a democratic country that is founded on the belief that all people are created equal with equal rights, these health disparities and the injustices underlying them should be unacceptable. These disparities are a reflection that we, as a society, believe more in market justice than in social justice. We can do better than that. We must do better than that if we are to prosper and advance as a society. Our challenge is to find ways to create a more socially just society, one that won't tolerate these kinds of health inequities. The first step is to acknowledge that these disparities exist, acknowledge that many are race-based, and acknowledge that they are unacceptable. That is the same challenge Dr. King gave us half a century ago. It is a challenge we have so far failed to meet. At a time when our state is becoming increasingly diverse, it is more important than ever to personally accept that challenge and then respectfully challenge each other to begin a conversation about how to make changes in our social and economic systems that will eliminate those inhumane injustices. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.